All right, let's jump right into this rapid fire explainer. If you've got an exam coming up literally tomorrow, or you just desperately need a high yield refresher on healthcare administration, you are in exactly the right place. We're taking some raw, incredibly dense study notes and chunking them down into a highly effective, visually structured cram session. Basically, no fluff, just the facts you absolutely need to know to pass.
To get through this fast, we're going to knock out 4 vital areas today: core management principles, key community health roles, mastering records and reports, and finally, levels of health centers.
Starting right off with area number 1, core management principles: leading, supervising, and monitoring. Okay, so leadership. It's not just some vague buzzword, right? It actually breaks down into 3 distinct active steps. When you're leading in healthcare, you're doing 3 things: influencing, directing, and guiding. And you might be doing that for just one individual or a whole group. But here's the kicker. All of this action has one ultimate aim, and that's achieving a desired goal. So pro tip for your multiple choice questions: if you see components of leadership, hunt for those 3 verbs: influence, direct, guide. You'll nail it. Now, this next one is a trap people fall into all the time: mixing up supervision and monitoring. Think of it like this. Supervision is all about the people. You are physically overseeing and guiding your team to make sure their duties are done correctly and efficiently. Monitoring, though, that's about the program. It's the continuous, systematic gathering of data to check on how a program is progressing. Simply put, supervision watches the who, while monitoring tracks the what.
Moving right along to section 2, key community health roles, basically deciphering the alphabet soup of acronyms.
Looking at these raw study notes, you can see that nailing down these specific roles is absolutely critical for understanding how the healthcare hierarchy actually works on the ground. So let's build some mental flashcards. Flashcard number 1, ASHA. That's ASHA, which stands for Accredited Social Health Activist. Burn that into your brain. These folks are the essential frontline workers who actually connect the local community to the broader health system. Flashcard 2 is a bit of a mouthful. VHSNC. That represents the Village Health, Sanitation, and Nutrition Committee. Notice how that name perfectly captures the big 3 of rural health, right? Basic health, clean sanitation, and proper nutrition. They look at the whole picture. And flashcard 3, MLHP. This is your mid-level health provider. These are the pros stepping in to bridge that crucial gap in clinical care right at the community level. All right, we're halfway there. Section 3, mastering records and reports, all about documenting care. So, what's the actual difference here? Well, think of a record as your anchor. It's a permanent, static, written document. It just sits there. A report, on the other hand, is active. It's the actual communication, written or oral, of the info pulled from those records. And crucially, reports are submitted to higher authorities. So records stay put in the filing cabinet, but reports travel up the chain of command. Now, as the medical world rapidly goes digital, here's another classic point of confusion straight from our notes. You've got to know the difference between these 2 digital systems. Here is the absolute best memory hook for your exam. An EMR, electronic medical record, is really just the digital version of a patient's chart at one specific practice. But an EHR, electronic health record, is built to be shared. Remember, the H in EHR means it relates to the whole health system. It travels outside of one single office and gets shared across different healthcare facilities. EMR is local, EHR is everywhere. Last stretch, section 4, levels of health centers, primary versus secondary. You need to keep this distinction razor sharp in your head. A primary health center, or PHC, is exactly what it sounds like. It's the primary, literally the very first point of contact between a rural community and a medical officer. But when a patient needs more advanced care, they get bumped up to the community health center, or CHC. That's where you step up to secondary level care. Just remember, primary means first contact, community steps it up to secondary. All right, to lock all of this in before we wrap up this cram session, let's do a super quick self-test. Based on what we literally just talked about, is a record a communication sent up the ladder to authorities, or is it a permanent document? Think about it for a second. If you said permanent document, you totally nailed it. The report is the communication. You've just crammed some seriously high-yield health admin concepts into just a few minutes. But here's something to chew on as you study. As rural populations explode and digital systems like EHRs get more and more complex, how are these primary and community health centers going to adapt to handle that massive wave of data? Keep using those memory hooks, trust your last-minute prep, and go crush that exam.